Good morning, everyone. Welcome to the Hidalgo County Wellness Program 2021 Virtual Wellness Fair. My name is Diana Hualpa with the Hidalgo County Wellness Program, and I'm really glad that you joined us today. Before we get started, we want to make sure that the technology is working for us. So if you can see the slides clearly, and if you can hear my voice clearly, please click on the raise hand icon that is located at the bottom of this Zoom webinar software. Perfect. Thank you so much. Again, if you can see the slide clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Thank you for everybody that raised on their hand. It looks like we're good to go technology-wise. I do have a couple of reminders before we get started. Reminder number one is that we have 11 additional presentations as part of our 2021 Virtual Wellness Fair. Therefore, if you haven't set up a reminder for this or any of our upcoming webinars, I do invite you to do so through the Hidalgo County Wellness Program Fair website. And the second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum. You can send them throughout the webinar and we will have a Q&A session at the end of the presentation. At this point, I do have the pleasure of introducing our guest speaker for today, Dr. Priscilla Ibarra Becerra. Dr. Ibarra Becerra is a board-certified family medicine physician. Dr. Becerra earned her medical degree in 2015 at Universidad Autónoma de Guadalajara, Mexico, and afterwards, she completed her family medicine residency at the Department of Family and Community Medicine from the University of Texas at San Antonio. Dr. Becerra has earned certifications in advanced cardiac life support, basic life support, and as part of her experience, Dr. Ibarra Becerra aided as a resident physician at the University of Texas Health Science Center in San Antonio, and has participated in community service programs such as the Heaven for Hope Dermatology Free Clinic and the Children's Memorial Hermann in San Antonio, Texas. Dr. Ibarra Becerra has also received the first-year resident recognition award for meeting the core competencies of compassionate patient care, medical knowledge, communication skills, and system-based practice. In the present, Dr. Ibarra Becerra works at South Texas Health System Clinics, where she serves as a family medicine physician to the community of the Rio Grande Valley in South Texas. Without further ado, I pass it over to you, Dr. Ibarra. Thank you so much for being here with us.
Thank you so much for that introduction.
Yes, and thank you for being here. At this point, I'm gonna go ahead and stop my share. That way you can go ahead and start sharing your presentation.
Oh, okay, so I have to share my presentation. Sorry, I thought it was already gonna be there. No worries, 1 second.
Perfect. And thank you so much for taking the time this morning to be here with us. We are super excited. We do have our Hidalgo County employees joining us and
Great.
Just wanting to learn more information regarding the topic.
Yes, great. That's awesome. And I love having this community engagement sessions that, of course, it's to help the community and help them get more information. So I'm trying to share my screen. All right, can everybody, is that?
Yes, we are looking at your presentation. We're currently on the PowerPoint section and on the presentation.
Okay, I don't know which screen are you looking because I have two screens. Is it the whole screen?
It's actually the one with the comments and the notes on the right.
Okay, well, I don't know how to.
I think we should be fine with that.
It's fine. Can you see it like this?
Yes, that works perfectly.
Okay, we'll just go like that. So basically, benefits of good night's sleep. So we're gonna break it down just very, very fast. Objectives here is why is good to have a good night's sleep. What chronic diseases are linked to poor sleep. This is very interesting. And I don't know if, please welcome, I guess I'm welcome to raise your hands or any questions. I don't know if you can help me with that.
Absolutely, Dr. Ibarra.
Okay.
So we do
It's
have
like,
a chat version and
okay.
they will be able to submit their questions and
Perfect.
we'll answer them.
So also we'll be talking about sleep disorders and sleep hygiene. Okay, so we'll go over all that very specific. So benefits of sleep. So it is, it has been a lot of research that adults need about 7 to 8 hours of sleep, and that is shown to have many benefits. The most important here, I just listed a couple, but there are many more. It can improve memory. So memory, when we sleep, we do increase our brain connections. It can increase our mood. You know, if we don't get a good night's sleep, we're moody, we're like angry and more anxious sometimes. It can also improve weight control. So when we sleep, we have these two hormones, leptin and ghrelin, which control our appetite. So getting a good night's sleep helps auto-regulate these hormones. It can also help with cardiovascular health, of course, give us more energy, work performance. We're going to be more productive. We're going to improve our stress, and of course, have a good quality of life in general. Okay. So not getting enough sleep is linked with many chronic diseases, and this is my bread and butter, right? This is where I want to spend more time. So why, you know, people think good night, oh, they procrastinate. Oh, my sleep is not important. I'm not gonna sleep because I have to do all these things at home. And then we get like, this is not good for us, because then we get sick, right? So it's been linked to diabetes type 2, heart disease, you know, all that, heart attacks, heart failure, hypertension, high blood pressure, obesity, depression, chronic pain. People who have chronic back pain or, you know, neck pain, shoulder pain, but not getting a good night's sleep, that can increase our chronic pain. It can also increase our anxiety, our worry. It can worsen our concentration. You know, we feel blurry and low motivation. It is also linked with motor vehicle accidents that can lead to injury and can lead to disability. So, you know, people it's very sad. They get into accidents and they can't work again. So it's very important to get in a good night's sleep. Can also be linked to mistakes at work and mood. People can get anger and sad, anxious, being just irritable. So all of that is why good night's sleep is good, in other words. So why do I feel so tired, right? I don't know, maybe like 80% of my patients come to my clinic and say, I feel so tired all the time. Well, the first thing I ask is like, are you sleeping okay, right? So we're gonna go over sleep disorders. There are many sleep disorders, but these are the most important. And what is very shocking is that 50 to 70 million Americans with sleep disorders are undiagnosed. That means people don't know they have this and they're just, you know, going by their day. So the first one is insomnia, right? And I don't know if we can show a hand. I can't see the hands here, but if anybody knows who suffers from insomnia, just to have like an idea of how many people in this chat could be possibly suffering from insomnia.
And right now we are receiving some of those notifications. We currently have 8 and they keep increasing.
Okay, so yeah, more than 5 was my goal. So every time I talk about sleep disorders, there's at least more than 5 people that suffer from insomnia. Well, good luck. Good news is that we can treat it. So we're gonna learn about that. We are going to learn about sleep apnea. That's a very, very interesting diagnosis that can help you, you know, if we treat it, if we diagnose it and treat it, it can help you have a whole new life, right? Narcolepsy, we won't be talking about these ones too much. I'm going to focus more on insomnia and sleep apnea, but just for you guys to know that there's also these things that can cause bad sleep. Restless leg syndrome, that means the person is moving a lot, their legs, and it's this uncomfortable sensation of having to move the leg to release that tension or that uncomfortable feeling. And the patient cannot sleep because they have this at night. And that's also, we can treat it, right? It's a medical condition. And then traumatic events. Of course, PTSD can cause nightmares, and that is a totally treatable disease as well. So we're going to start with insomnia. So many of you have insomnia. So we're going to see the symptoms, right? So insomnia is the inability to initiate or maintain sleep, even if you have the time to sleep. So let's say you go to bed at 8 o'clock and really you go to sleep at until like 1 to 2 a.m. That's some kind of insomnia. Or it could be that you wake up multiple times during night. You were able to fall asleep, but then you wake up at 2 a.m. and then 3 a.m. and then again at 4, and you don't get that good sleep throughout the night. Also, you can have early awakening, and that's just waking up several hours before you have to. So you have to wake up at 7, you wake up at 5 a.m. and you cannot go back to sleep. That's also a kind of insomnia. And also excessive daytime sleepiness is another sign. So people sometimes don't know they cannot sleep very well, or they haven't identified, oh, maybe I cannot initiate, or maybe I cannot maintain, but they just feel tired. That could be one of the symptoms from insomnia. And it can cause functional impairment, meaning that, oh, they can't really concentrate, cannot really do their job, or focus on maybe moms, focus on the children's homework or stuff like that. So insomnia can be due to, first, side effects of medications, okay? I am a family medicine doctor, and this is very important for me because medications have many side effects. Surgeons have surgery, they operate, other specialties do other stuff. Family medicine can only do, medicines and recommendations. So it's super, super important that when a patient comes to my clinic, we go through all the medications one by one and see what we can take off, because you'll be surprised. There are many medications that just by taking them off, people feel way better. This is also a very important one. I see this one a lot, substance use. People, they say, oh, I have one beer before going to bed, and that helps me relax and helps me have a good sleep. So I want to be very clear. Alcohol can help you initiate your sleep, but cannot maintain it because it affects the REM sleep cycle. REM sleep cycle is the rapid eye movement, and it's a very important part of the sleep cycle that we have to have every night to get a good night's sleep. So alcohol actually inhibits that. So you can fall asleep, but then you cannot maintain it. So if you have that habit, I don't recommend it. It's not a very good habit. Try without it. It's going to be a little bit better as the days go by. Also, caffeine. Some people can say, oh, I cannot drink coffee after 5 p.m. because then I cannot sleep. And that's totally true. But some people, they can go to sleep fine, but they don't have insomnia, right? And tobacco can also activate some of the insomnia. Depression. Sometimes people with severe depression, they're very sad. They have a lot of worrisome, and all that worry in their heads is just thoughts and thoughts going through the night, and rolling, and it's thinking. And that's the kind of depression that can cause insomnia. Chronic debilitating disease. Any chronic pain, arthritis, or any pain, chronic back pain that will, allow the patient cannot get comfortable in bed. So that will cause insomnia. So I'm going through one by one, because by addressing each and any of these diseases, we can treat insomnia. So stress is also a big one. People have so much stress now with work and all these things going on, COVID. So we can treat the stress and then treat the insomnia. I say it very easy, but it's not, I know, but we can. And we treat the cause. So how do we treat it? Is insomnia is depending on the cause, right? So sleep hygiene, and we'll talk about it. There's also therapy, which is cognitive behavioral therapy, which we can treat the depression, the chronic, or the stress. We treat the psychiatric conditions, PTSD, whatever it is. And then medications, that will be like my last resort. Sometimes we do everything we can, but there's still that insomnia. Then we can do some kind of medications. for a very short period of time. I don't like to do it for a long period of time because then we're not treating the insomnia. This is just like helping. Any questions on insomnia? Anybody? Because I know that a lot of people said yes to insomnia, but anybody has any particular questions they want to ask?
At this point, we haven't received any questions, but I'm sure that during the Q&A session, we'll have some.
All right, we'll go on to sleep apnea. And this is where we're going to spend a little bit more time because this is so silent. So sleep apnea, what is sleep apnea? Sleep apnea is basically when we are not sleeping through the night because we are not breathing in the night, during the night, right? So one of the symptoms can be snoring. I get this a lot. Oh, my husband snores so loud, I have to sleep in the other room. And that is actually a disease. He can probably have sleep apnea, so we have to help him. So snoring is the first one. The brief, short periods of breathing. And this is very particular because the wife will tell me, well, he stops breathing through the night. And they get these gasp or snorting noises. For example, they're breathing and then they're snoring and then they stop snoring. And that's, they're actually stop breathing and then they come back and they wake up a little bit and then they go back to sleep. And that happens through many, many times during the night. So you're waking up. You don't think you're waking up, but you are waking up. You're going back and forth, and that you won't get that good night's sleep. Other of the symptoms is fatigue during the day. People can take a lot of naps very easily, falling asleep while watching TV. Sometimes they're driving and they're falling asleep, which is very dangerous. Or they just get in the car and somebody else is driving and they fall asleep completely. They are snoring already. So that's one of the other symptoms. Chronic fatigue. You know, they're too tired to exercise, they're too tired to go and play with the kids. Lack of concentration. Sometimes it's very hard to concentrate when you're not getting enough sleep. And this can go, sleep apnea can go for years without being diagnosed. And people then get the consequences. Well, I will talk about them too. And sometimes just being unable to lose weight, even with healthy diet and exercise. And I get this too a lot. People have, doctor, I tried so many diets, I've exercised, and I still cannot lose weight. Well, that could be because you're not getting a good night's sleep, and that could be sleep apnea. Of course, this is just general symptoms. It's not a particular age. Patient has to be seen fully and had a whole history and physical to be able to pinpoint a good diagnosis. The next one, the other symptom is nighttime urination. And this one's very, very important because especially for males, people think that, oh, it's the prostate. They have a prostate problem and then they give medication for prostate, and it's actually sleep apnea is very, very related to nighttime urination. And it's a whole mechanism on how the lack of breathing affects the kidneys, and the kidneys produce more urine. Basically, that's the whole idea, which will produce more urination. So the patient will go to the bathroom many times, and many times it's just more than 2. Okay, which is very surprising, right? People can get up to 6 times a night. And this is focusing only on adults. Kids and elderly more than 65 years old, it's different stories. Headaches, sleep apnea can be due to headaches. Headaches can cause, sleep apnea can cause the headaches. And this related to we're not having a good night's sleep. So this will just be very tired and produce like tension headaches throughout the head. They cannot, sometimes they take Tylenol, and Tylenol doesn't really do anything for them. And we have to do a sleep study. We'll talk about that too. And also dry mouth or sore throat on awakening. So patients, because they're snoring, they open their mouth and they're breathing. So they have dry mouth. People who's at risk of having sleep apnea, right? People who have high blood pressure, people whose BMI is 35. And what's BMI? So it's body mass index. And super easy. You can just Google what's my BMI. You put your height and your weight, and that's your BMI. And if it's more than 35, then you are already at risk for having sleep apnea. Neck circumference, so that's just how large our neck is. And if it's more than 15 inches, that's another risk factor of having sleep apnea. I see some questions here. Oh, I find, okay. Really quick, I just want to answer this question. So I do have problems in sleeping because I guess I'm always worried about work, family, etc. I take generic brand Ambien, but I only take half a pill. This medication is real good. I can sleep and wake up good, but if I don't take this pill, I will not sleep until maybe, yeah, you're not the only one. I've tried also sipping on cough syrup, and also that helps, but I have to take something because I will not sleep on my own. I don't want to continue to take meds to sleep. So it looks like you're worried about many things. So we have to target the worrisome, that anxiety, those thoughts. And we'll sleep about sleep hygiene. Maybe that's going to help you a little bit. The next attendee is I am diabetic, and sometimes I wake up 3 times a night to pee. Is bad. So for that, I don't know what medications you are on that can cause that, but definitely bring that to your primary care doctor. Good questions, very good questions. All right, for continuing with the sleep apnea, so those were the symptoms and the risk factors, and now we're going to talk about what happens when we stop breathing. And I just wanted to get a little bit deep on this subject because I want to speak about the complications. So what happens when we stop breathing? And this is only particular to people who have sleep apnea, okay? Not everybody who snores have sleep apnea, and not everybody who has all those symptoms have sleep apnea. They have to go through a diagnosis first. So basically, it can cause pulmonary hypertension because the vessels constrict. And if you see, this is a normal pulmonary vascular. This is nice and big, and this is all constricted and small. Okay, and these are all small. Look how small this one is, and look how big this one is. So this is pulmonary hypertension, can cause heart failure, and then can cause heart arrhythmias. It can also cause stroke, impotence, heart attack, and it's linked to many other diseases, but those are the most important. So the treatment will be depending on the case, right? It will be a CPAP or treat the heart conditions, or if there's a nasal obstruction, they can do some kind of surgery, just a small surgery. So what is my point? My point is to get tested, right? If you have any of those symptoms, snoring, fatigue, you take naps, you have headaches, and you have some of those risk factors, get a sleep study. A sleep study is a polysomnography. Basically, you go to a sleep center, they will connect some electrodes here, and then monitor your breathing, monitor your chest rise, monitor your oxygen. You go to sleep to that center through the whole night, and they'll monitor how many times you stop breathing if you have sleep apnea. And they measure the apneic episodes. Apneic means that you stop breathing, and those is more than 5 episodes. That's a positive test. All right. And I just put here everything that the polysomnography will monitor for REM sleep, sleep fragmentation, sleep stages. So it's very, very complete study. I think everybody who snores or just has one symptom should get it, or even if they have overweight, I think it's very important to get it done because there is many complications. All right, before we go any further, the CPAP machine covered by our insurance, yes, very, very, well, I don't know what insurance, sorry, I don't know what insurance you guys have, but sleep apnea is a most likely covered diagnosis.
And if I can just add to that, Dr. Priscilla, we do have representatives from Aetna in our exhibit hall, so you can definitely ask those questions directly.
Oh, perfect. So they can actually ask. Yeah, it will be obstructive sleep apnea will be the diagnosis, and if that will cover the CPAP machine.
Perfect.
That's a good question. But even if it's not covered by insurance, and this is very, very big, I think all insurances should cover it because of the complications. Either change insurances or save some money to get it, because it is worth every penny to get treated. All right, so now we're gonna talk about sleep hygiene, and this is the most important slide about sleep habits, right? If people, those people who mentioned that I cannot sleep because I am anxious or I'm worried, I don't want to take medications forever. This is some of the things that you guys can do. This is more for insomnia. And just by doing this, you'll be surprised. This is like every patient who comes to my office and they have insomnia, I do this for them. This is what we start. So how can we improve our sleep habits? So keep a sleep diary. This is important. I know it sounds silly, why am I going to keep a sleep diary? But it will be giving you a pattern about what we did, what time did we went to sleep? What time did we, usually we do this in the morning, not while you're trying to sleep, right? What time we went to sleep, nighttime awakenings, maybe you got 5, what times, if you had nightmares, if a nightmare woke you up really fast, if we drink alcohol that night, or what time that was the last time we drink caffeine, did we exercise that night before going to sleep or that day? So that's really important. That's going to bring a lot of information for you and for your doctor who's treating you for insomnia. The next one is go to sleep and get up at the same time, including weekends. And that's a hard one, I know, but it's important to have a pattern. So we have a circadian rhythm, right? And it's related to our hormones. Our hormones liberate more like in the morning and we're more awake. And then during the night, they start to like, okay, we need to go to sleep. So we have to fix that circadian rhythm. If you go to sleep every time at 2 a.m. in the morning, 2 a.m., 2 a.m., that's not going to work. We have to get our sleep hours back on track. All right, so the next one is make sure your bedroom is quiet, dark, relaxing, and comfortable temperature. And this is, people will be surprised, but dark is important because you want it dark because light actually stimulates other hormones to make us awake. And this is the other why TV, computers, smartphones, looking at all of this in the dark room is giving us that light in our eyes, and our brain is receiving that signal that it is still daylight. Hey, you still need to be awake. And that, we're trying to take that, hey, it's night. Let's keep the dark room, okay? Relaxing, you have to, of course, I don't know, the setting, don't be sleeping on the couch, you just go to your comfortable bed. And then comfortable temperature, if it's proven that if the temperature is a little bit high, low, so a little bit colder, it's a little bit better to fall asleep versus if somebody's hot. So again, remove the computer, smartphones, don't look at your phone, just, before going to bed, half an hour, just put it away, put everything away, just don't look at it. It will give you also self-peace, let go of all that technology. Avoid large meals right before going to bed, because large meals can stimulate our digestive system and keep us up. There's these noises and maybe reflux that can keep us up. So maybe a small meal, or eating having dinner 6 p.m. and then going to bed at 9, having 3 to 4 hours in between. Physically active, this one is my favorite. I love exercise. I think exercise is life, is energy, is super important for our health, for our brain health, our heart, our lungs, our muscles, our bones. So I think everybody should be at least walking. If not, they can go to the gym. If not, because of COVID, just walk. Or there's a bunch of YouTube videos that you can do at your home for free. Some yoga, some Tai Chi. And this is really nice because this yoga and Tai Chi are It connects your body with the movements, with the breathing, and it helps relax the muscles, relax everything. And you're focusing your attention on something else than other than your life. You know, it's like an escape. CBT, that's cognitive behavioral therapy, it can address the thoughts, the behaviors that keep you from sleeping. So for example, if you have, oh, I have so much worry, I cannot even stop thinking. They're just going. It's like a little a hamster going all day and all night. CBT can help with that too. And then breathing techniques. I like the 4-7-8, and this is fabulous. I do it every single time with my patients who have any kind of depression, anxiety, or they just cannot sleep. I go through it with them, and I do it in the room with them because it also helps me. So the 4-7-8 is you breathe in for 4 seconds. So, and if everybody wants to do it, you know, nobody's watching. So you inhale for 4, you hold for 7, and then you exhale for 8. And that just feels fantastic. The more you do it, you can get a little bit dizzy if you do it like very often, like in one after the other one. So take a little break, breathe normal, and then just go through it, and it feels really amazing. I recommend this for whenever we feel anxious or we are at bed, you know, tossing and turning, and there's just so many things going. Focus on your breathing. Do the 4-7-8, and you can just Google it, you know, 4-7-8 technique for breathing, and there's going to be somebody telling you how to do it too. And then the last one is a guided meditation for sleep. You'll be surprised, for everybody who's just worrisome. There's this it's a webpage, insidertimer.com, and it's free. You can log in at any time. You don't have to log in, you have to open the web page. You can have it on your cell phone saved, and there's always nighttime meditation, morning meditation, middle day, how to deal with anxiety. There's chat groups that you can join for free, people with the same problems, and how to do yoga, how to do Tai Chi. They have a lot of stuff in this website. So those are my sleep habits for everybody. Any questions?
Yes, absolutely. Let me go ahead and just share this screen really quick so we can have our Q&A session. And I know that we have already answered a couple of them, but we do have a few of them. So the first one that we had is, I would like some tips or techniques to help fall asleep. So I guess it goes back to the techniques that you just mentioned, but I don't know if you want to add something to what has been mentioned or highlight something specific.
Well, you can start doing these sleep habits, and I don't know if we can leave that last slide there so they can take a picture of it.
We will actually have this recording available. So
okay, perfect.
Available for them to rewatch.
Yeah. And if you tried every single thing, and I recommend to try one thing at a time. Okay, don't do everything, because then it's just too much for us to process. Maybe for the first time, maybe just keep a sleep diary, maybe for a week, you know, and then maybe for the other day, maybe, okay, I'm gonna see if I can do some exercise, maybe some yoga before going to bed, maybe some Tai Chi, some just movements. And everybody is different. Not all of this will gonna work for everybody, but if one thing works, then that's best, right?
That's already a win, right?
Yeah.
Great, Dr. Ibarra. Now, the next question that we have is, how many hours of sleep will it be okay?
7 to 8 hours for any adult. So if we sleep around 5 hours, there's not going to be a lot of that cycle. We have to go to REM cycle. We have to go to the, you know, the sleep is, it's a whole specialty. There's doctors who go through only sleep medicine. And it's just something so interesting, because we spend half of our lives sleeping, right? That's how important it is. So it's actually that 7 hours is going to be the time that you're going to go through every single sleep stage to have the benefits.
Amazing. Thank you so much. And the next question that we have is snoring bad? Is that bad?
So snoring, that's a very interesting question because it can be bad, but it's, what is snoring, right? Snoring is just air going through our respiratory system and it's making some noise because something is blocking it. All right, so sometimes it can be a large neck, a small pharynx, so a small opening of the airway. And this happens also in kids, you know, they have the adenoids or the tonsils all enlarged and they're snoring. Kids who snore, they have to go to the doctor, period, right? But it is kind of being very accepted, I guess, in our society, you know, men snore, that's just normal. Well, it can be normal, but it can't. That's why if you snore, I urge you to just get a sleep study and then for sure know that you're not having any of these diseases or sleep apnea in specific.
Absolutely, to just rule out anything that might be causing that. Perfect. And the next question that we have is, what are some of the CBT methods? And I know you elaborated on the cognitive therapy.
There are many, and actually I don't go in through like all the CBT methods because that I refer to the therapist. Soon we'll have here our own therapist in our clinic and we can do this with the patient, like after I walk into the room. That was going to be amazing, but for now it's very complex. It's a lot of you spend a lot of time with a patient and really truly help them understand and explain the techniques. So it's also it's out of my scope for that, but I know it works.
Definitely. And we do have licensed counselors that are going to be participating in their presentations. We also have it to our employee assistance program. So definitely, I think that's something that we can definitely contact them to have a little bit more information and background, like you mentioned.
Awesome.
And Dr. Ibarra, our next question is, what are the negative effects of eating, and I guess it was negative or positive effects of eating right before going to sleep? Can you gain weight if you have like a unhealthy meal before going to bed?
Definitely. So when you eat, I'm all about eating right. Okay. This is important because now it's very easy and it's very convenient to just get fast food. Oh, I don't have time to cook. Let me just get a pizza. Right. But if you think about it, we're going to bed, we're going to sleep, and we're going to sleep for 7 to 8 hours, hopefully. So all that carbohydrate load that you just ate, that pizza or that hamburger, is going to be stored because you're not going to require it, right? You're not going hiking, you're not going to, you're not going to have any physical activity. And the requirement for sleep is very tiny. The energy requirement is very, very small, that everything, your body is going to, oh, what do I do with all these carbs? I'm just going to store them. And they get stored in your liver, and then in the long run can cause fatty liver disease, which can cause cirrhosis, which is also something that we can talk about in another talk. I'll be very happy to talk about fatty liver disease. But yes, eating right, eating a small meal, maybe a small salad or maybe a smoothie or something with not many carbs can also help you lose weight or not gain weight.
Absolutely. Thank you so much, Dr. Ibarra. And our next question is, can we take magnesium pills for sleep? Are they okay to take?
So magnesium is an electrolyte, and I only recommend it for people who have low magnesium. That's all.
Okay. What about melatonin?
Yes, melatonin is a hormone that is normally produced in our brains that help us sleep. So they came out with this melatonin, extra, kind of like extra help. It's a very natural way. It's not addictive. 3 milligrams, no more than 3 milligrams. If you go to 10 milligrams, it's not gonna do anything else. And it's just like an aid. It's not gonna, oh yeah, you're going to have you're going to have a good night's sleep. It just help you. It might help you. It might not help you. I usually just give it to people who are elderly, more than
Mhm.
65 years old, because the circadian rhythm is affected. So they're not producing that hormone that much at night. And that's just helping them a little bit. But you can try it. If you have insomnia, you can try it. Definitely, it's over the counter. And if it helps, it's not as bad as the other medications.
Okay, sounds great. Well, thank you so much, Dr. Ibarra, for being here with us. Thank you for presenting on this important topic. And thank you, everybody that joined us. We did receive a lot of questions, so I know that we probably missed a few, but we'll definitely appreciate your engagement, and we'll hope to see you in the upcoming presentations that we have. Thank you, everybody, and stay safe and healthy, and I hope you have a great day. Thank you so
Thank
much.
you.